I think one of the many great things that Windrose is able to do for our community is to provide health care to such a wide and diverse patient demographic.
There's no greater reward than helping someone find a new lease on life. That's what I love about Windrose. It's a bridge from the patient to the resource, built by skillful, professional, and compassionate hands. We have great successes for our patients every day, but I believe it's the little things that our staff do that make all the difference.
Hi, I'm excited to tell you about National Health Center Week. Windrose Health Network is one of 48 community health centers, which of 19 are federally qualified health centers. That's what Windrose is. We offer care to anyone and we welcome everyone through our doors. If you need an interpreter, we have interpreters. If you need special care, we can refer you. Windrose does our best every day to treat every single patient that walks through our door with the greatest respect.
A lot of people, I think that the concept of a community health center has changed over the last 55 years. I mean, in the beginning, back in 1965, there were just two community health centers. One of them was in Boston in the projects, and one was in the Mississippi Delta. So I think back then it was very easy to conceptualize the idea of a community as being, more or less a geographical region. But, here we are, we're in the year 2020. 55 years later, there's more than 1,500 community health centers and more than 11,000 service sites. So the idea of a community has changed quite a bit. So that's especially true for Windrose because, we have a community on the south side of Indianapolis that is part of the larger Indianapolis Metroplex. And then you have a practice that's in Hope, Indiana, which is, a very integral part of that very small community. The same could be said for Trafalgar and the community of Trafalgar, Indiana. So once again, it's a very different, concept between being something that's very urban and diverse and part of the larger metroplex, and then you have a very, very small community. So we also serve what I would call sub-communities within those practices. We have the Hispanic community that we serve, we have the Burmese community, we have the behavioral health community, the deaf community, the autistic community. So even within the larger subset of our practices, patient population, we have these subcultures. So, again, it makes me very, very proud to say that our staff is able to serve all of these people together, even though they may be different, unique communities, part of the larger Windrose Health Network community patients. So again, it's my favorite thing about Windrose, and I'm very, very happy to say that we serve all people regardless.